Hi, my beauties. I'm Dr. Stephanie Capel, and today I'm going to be talking about the Pico laser. So the reason why I wanted to talk about the Pico laser is because it's one of the most advanced technologies in the laser industry today. And it's called the Pico laser because it's a picosecond, which is really, really fast. It's the fastest laser on the market, and I'm so excited because we just got one and we opened our office about 5 weeks ago, and that was one of the first things that I bought when we opened this new space because I'm super excited about the technology. You guys know I always keep you in the know with the latest and greatest and the most advanced technology, and this is it. So a picosecond is a trillionth of a second, and a nanosecond is usually what our Q-switch lasers are, and a millisecond is also called a long pulse laser. So the picosecond is basically a trillionth of a second. So when you take amount of energy and you put it in a very short amount of time, which we call a pulse width in laser medicine, it's taking a lot of energy in a short amount of time, which makes it a very powerful treatment when we pulse the laser. And so the benefit of that is that, without getting too technical, it turns it into a photoacoustic reaction. And what that means is, instead of being a photothermal reaction, which happens with slower lasers, and when I say slower, I mean like a billionth of a second, which is still pretty fast, but these are lasers we're talking about. What happens is there's no dissipation of heat. And the reason why that becomes important is because it's safe to treat in darker skin types. Just as I mentioned in an earlier video about clear and brilliant permea, Pico, Pico Way, and the picosecond laser are engineered for darker skin types because we always have to worry about post-inflammatory hyperpigmentation with lasers in skin of color or hyperpigmented skin. And the reason why Pico is a safe laser treatment to use in darker skin types is because when the energy is delivered into the skin, it shatters the pigment, which is what we call the chromophore. And there's no dissipation of heat because it's so fast and so powerful, it's a photoacoustic effect. It's like breaking the sound barrier. It just shatters the pigmentation. Versus other lasers like Fraxel, for instance, which I do a lot of as well, will dissipate heat. That heat stimulates the melanocytes, which are pigment-producing cells, which release melanin, and they cause post-inflammatory hyperpigmentation in skin of color. So what that means is, all post-inflammatory hyperpigmentation is when there's any traumatization of the skin, whether it's a curling iron burn or a laser, because a laser is considered traumatization of the skin. Your skin may be treated with the laser for, say, an acne scar, for example, but your melanocytes, which are the pigment-producing cells, are going to release melanin, which causes darkness in the area that's treated. So it's great because your acne scar gets treated by the laser, but now you have this dark spot in the area that was treated. So what's the answer to that? Usually we have to use some type of pigment control blending cream or hydroquinone or non-hydroquinone, but when you're using lasers like Pico, that's not an issue, and you can safely treat skin of all color, and you don't have to pre and post condition the skin with certain treatments like hydroquinone. So that's the beauty of it. The other reason why I really like the Pico Way laser is because it has the Pico focus array. So there's a collagen stimulating anti-aging handpiece that you could put on this laser platform, which is beautiful because it's a great preventative approach to stimulate collagen, and has really great anti-aging properties, and it has no downtime, and usually it requires multiple treatments to get to your endpoint goal, but it's a great way for my younger beauties who are in their 20s, 30s, and 40s to have great anti-aging effects without the risk of downtime and with no pain, and a pretty easy procedure that takes about 10 to 15 minutes. Usually we give you about 3 treatments spaced 1 month apart, and you can do this once a year, once every couple years for potent anti-aging effects. So that's the other platform that this laser is really useful for. But to be honest, the reason why I really wanted this laser is because it's exquisitely great at treating brown spots. So whether you have brown spots on the backs of your hands or on your face, there's lasers that will help reduce the incidence of brown spots, but Pico Way and Pico laser is really great at just spot treating those brown spots. So the way it becomes important to incorporate into laser medicine in my practice is that, say someone comes in and they have some sun damage, they have some melasma, which are brown patches of pigmentation on the face, and they have some a little bit more stubborn areas of discoloration, whether it's a lentigine, which is basically a brown sunspot, or a melasma, or say it's a hyperpigmented acne scar. And say I do a different combination of lasers. We do a clear and brilliant permea, which makes everything look a little bit better, but there's still some residual brown spots. That's when the Pico Way is used to kind of spot treat those little brown spots, and essentially just takes them away without any risk of scarring or any hyperpigmentation. So it's been great to incorporate this into my practice. And I always say lasers are like golf clubs. There's different lasers that you use to achieve certain goals. Now, If you're more on a Medi-spa level, I always say microneedling or an IPL or a BBL, which stands for broadband light. Those are kind of like more Medi-spa level devices where there's not a lot of engineering or technology. It's just kind of like a one-size-fits-all or a jack-of-all-trades, master-of-none type of device. But when you go to a board-certified dermatologist or laser specialist who's laser fellowship trained, and you can look this up on the ASDS, which is the American Society for Dermatologic Surgery, to find a provider near you who is laser fellowship trained. Laser medicine is a little bit next level, and there's a little bit more technology and engineering in these devices that is probably beyond the scope of a Medi-spa, because the physics of these lasers, the photodynamics, the spot size, the settings, and the physics and how we adjust the settings, it takes a higher level of expertise. So you're not going to find lasers probably like Pico or Pico Way or Pico Sure in a Medi-spa. So a lot of patients come in and they'll say, oh, do you have an IPL or do you have microneedling? Well, microneedling is not even a laser. And to be honest, an IPL isn't either. It's just broadband light. But it's the Pico Way is like having a Lamborghini. I mean, I think like BBL or microneedling's like kind of having a Prius. Everybody's going to have one. They're, more common. That doesn't require a race car driver to drive a Prius. But if you have a Lambo and you have a race car driver and you have a racetrack, that's the car that you want to be in for speed. So lasers are kind of like that. And the Pico Way is pretty much next level, advanced technology. And when you combine different lasers together for a customized treatment and approach to a skin ailment, instead of using one device that kind of does a little bit of everything but not that well, or if you do lasers that spot treats brown spots, a V-beam that targets blood vessels, a Fraxel that's going to get rid of fine lines and wrinkles, and you combine these lasers, that's when you knock it out of the park. That's when you have those amazing outcomes. And it just comes from a higher level of skill and a higher level of care and expertise, but the results are amazing, they're incredible, and that's why we're able to achieve these great changes in the skin, because we're using these lasers appropriately, we're using them safely, we're not using a drop-down menu in the settings. We basically go based on endpoints and our knowledge of physics and photodynamics and lasers to achieve the goals that we're able to with these amazing devices. So Pico Way is the newest addition to our family in our laser clinic here, and it's one of my favorites, and patients have been really happy with it. Colleagues of mine, all of my world-renowned laser experts who trained me, all have this device, and it came highly recommended, and the data and NIH and FDA approved studies with this device was very impressive to me, and patients' outcomes are superior. So I'm happy to have it on board, and I'll try to post on it to show you guys before and afters, and just wanted to educate you guys on the latest and greatest in technology and lasers.